Via Skype by International Council of Nurses Chief Executive Officer Howard Catton. Howard, a very good morning to you.
Good morning and happy International Nurses Day to you.
You know, definitely we need to celebrate those on the front line who are up against the most, one would say, during this time. So much uncertainty, so much unknown with regards to COVID-19. Scientists are learning more and more about this disease as we go on. So their efforts on the front line is all the more appreciated at this time. 2020, Howard, is a chance, I guess, to showcase what nurses can do to improve the health of everybody. How is your organization celebrating nurses today?
So you're absolutely right. This is a historic day for nurses. It's the 200th anniversary of the birth of Florence Nightingale in the first ever World Health Organization designated Year of the Nurse and the Midwife amidst a global pandemic. So nursing is absolutely in the spotlight. In the last 24 hours in the run-up to today, we have actually been commemorating nurses we have lost as a result of coronavirus. Tragically, we know of at least 260 nurses around the world who have died as a result of contracting coronavirus. We believe that a significant reason has been the lack of protective personal equipment, and we have been calling for much more support for nurses. But today we move on to a celebration to celebrate everything that nurses are and what they do. The theme for today is nursing the world to health, and it could not be more apt given what people in all countries are seeing nurses are doing to save lives. But what we also want is from today, you said this as well, that we must make a step change in the investment in nursing and in our health systems. Coronavirus has exposed the fragility of our health systems. We went into this pandemic 6 million nurses short worldwide. The real tragedy of coronavirus would be if we don't learn the lessons and we don't invest more in health.
You know, Howard, around the world, we see reports of nurses fighting for improved working conditions, fighting to improve the image of nursing, the nursing profession, fighting for a decent wage. What battles have you won as an organization in terms of improving the lives of the men and women who are trained to take care of the sick and infirm?
Look, when Florence Nightingale started nursing, it was a career that parents did not want their daughters and latterly their sons to go into. It was seen as very menial work. We've moved hugely beyond that. People see the care and compassion of nursing, but they also see its bravery, its courage, the immense technical skills as well. Around the world, people have come to their doors, their balconies to applaud nurses as well. We managed to secure this first ever report this year on the state of the world's nursing, exposing shortages and where we need more investment. We now have a chief nursing officer at WHO, at the World Health Organization. We think there should be one in every country, and we are seeing countries recognising that the key to improving access to health care is to better use the 59% of the health workforce, which are nurses and midwives. So we have and we continue to make very important strides, but it needs resources, it needs investments, it needs hard cash to deliver on.
You mentioned the WHO State of the World's Nursing Report, and among other things, the report highlights areas for policy development for the next 3 to 5 years. Give us some of the key findings and key recommendations of this report.
So, yeah, a seminal report, and in 3 words: education, jobs, leadership. We need to invest in education. We need to globally to educate more nurses. The spotlight that's been put on nursing around the world, I think we can use that to attract people in, but it needs investment in education in universities. We need better jobs. It's not just a question of recruiting people in, but then retaining them. good pay, fair pay, decent work and conditions. And then we need to see more nursing leaders. If Florence was with us today, I have no doubt that she would be stood alongside prime ministers and advising on the science and the public health approach. We've got some fabulous nurse leaders doing that around the world, but we want to see many, many more. So that's the roadmap for us: education, better jobs, leadership.
You mentioned Florence Nightingale a number of times now. We're celebrating, today is the 200th anniversary of the birth of Florence Nightingale, probably one of the most famous nurses in history. She was born, I'm told, in Florence, hence the name Florence Nightingale in Italy, and she died in the UK. And we're told that she changed the perception of nurses back then. Talk to us about the perception of nurses now and how much it has changed over the years.
So when Florence, who, as you say, is recognised as the mother of modern nursing, she was a very well-educated woman who went into nursing. And her parents and her social circle didn't want to, because they saw it as very low-status work. What she did within nursing was she brought data and statistics to how healthcare was delivered and improved infection prevention and control. One of the really observations that I make today is how much of our approach to infection prevention and control for coronavirus is grounded in the work that Florence did. She also wasn't afraid to challenge the establishment. She fought for a royal commission in healthcare to look at healthcare in the Crimea War. She took on medical power where that was very, very dominant as well. You can see those foundations in nursing today, but I still think, and the report, the State of the World's Nursing Report, also highlights that because it's overwhelmingly a female profession, there are still problems with lack of value, discrimination, and inequality as well, in issues like pay, in issues like career progression. I think we are changing the image of nursing. I think coronavirus is doing that hugely in the way that I said. But we need to, the accolades, the warm words, the applause, they're great. But a lot of nurses I say that now needs to translate into actions. We've had this before. We've had you're great and thank you for everything that you do, but they're not backed up with investment and resources. And that's the mindset change that we need here. When we invest in health, it's not a nice to do, it's not a luxury. What we're seeing through coronavirus, investment in health is an investment in our national security, our economic security, our ability to go and see our parents, our loved ones, to walk in the park.
You know, many have described nurses as being the angels among us, fighting on the front lines against this COVID-19 pandemic that the world is currently going through. I mean, they are in many respects the best of us, isn't it? But being on the front line, to a certain extent, means that there's a lot of stigma also attached to this virus. Talk to us about some of the issues that nurses are going through with regards to stigma from COVID-19.
So firstly, you're absolutely right that the work on the front line is hugely demanding. People are putting themselves at greater risk. Physically, it's hard work, wearing PPE, long shifts. Mentally, psychologically, it's also demanding as well. People are dealing with more deaths than before that they normally would. They're also having to step in and provide emotional support to patients where patients' families are not able to be with them as well. So these are massive demands that we're putting onto nurses. But you're right. We are seeing in some countries, nurses have been subject to abuse, verbal abuse, and even some physical attacks because people are fearful that they are spreading the disease, the virus, in some way. Now, this is completely unacceptable. It's totally reprehensible. We have called on governments to take a zero tolerance approach, but it's probably the result of fear and anxiety and ignorance amongst people generally. And to deal with that, we need governments to have very clear public health messages about what people can and can't do to not only protect themselves, but to protect their family, their loved ones, but also their health systems. When the disease and the virus spreads, the risk is that it could overwhelm our health systems, our already hugely pressured nurses, doctors and healthcare workers. So the clarity of public health messages from governments and political leaders that people understand and believe is key here as well.
Our health is interlinked, and our lives are interlinked at this time. No doubt nurses and doctors are on the front line, but you would agree that the battle also needs to be fought by individuals and families. That's how we're going to stem the spread of this disease. Howard, thank you very much indeed for your perspective and your time. Thank you very much indeed for your time.
Thank you very much.